How's it going, everyone? Dr. Dan over here at my chiropractic office. We're going to go through a quick video on an ankle sprain and show you how we treat it, right? So the most common type of ankle sprain is a ankle inversion sprain. Basically where you're walking and you roll your ankle inward, all right? So a lot of times if you're walking, the most common way is to roll the ankle inward, which can cause strain of the peroneal compartment, so the leg muscles high up here, as well as the ligaments down in the ankle. The ATFL, the Anterior Talofibular ligament, is one of the most commonly sprained ligaments in the ankle. Generally, if you sprain an ankle, you may be prone to repetitive or recurrent ankle sprains on the same side if you don't rehab the ankle properly, right? And just to kind of go through a little bit of anatomy, everything in your body's connected, right? So when you're walking or running or moving, not just your feet or your knees are moving, your whole body is functioning as an organism. It's not like if you have an ankle problem, it can't affect your knee, it can't affect your hip. Everything's connected. So a lot of times when we have an ankle sprain, we may experience damage or strain to the lateral leg muscles and sometimes even the medial leg muscles, the middle guys. But if you did sprain your ankle before, you may have noticed a week or 2 weeks or even 2 months down the road that you may have developed like hip or even lower back pain or discomfort because things, they kind of shift out of the proper position, muscles tighten up, and ultimately you can end up causing more dysfunction throughout the body, right? Same thing, a different group of muscles on the front of the foot here can also work into creating injury up in the front of the knee and deep up into the front of the hip. So, important note to understand is that everything's connected. If you roll an ankle, a lot of the times you might just wrap it and compress it to get some of the swelling out of it, which is good, but there are specific rehab exercises that we can talk about in another video on how to properly rehab an ankle. Today, we're just going to show you a general treatment of what we do for an ankle sprain to help promote blood flow, reduce swelling, and help her ankle to speed up in the recovery time, right? So 3 major things that we're going to do: some soft tissue work to the ligaments, to the tendons, and a little bit up into the ankle. We're going to do a very gentle toe mobilization, a little bit of foot stretching just to help loosen up some of the bones in the feet, and then we're going to do some work up in her hip. We're not going to show that on the video, but we would work in the knee and the hip. And the last thing would be some laser to the ankle and to the knee to help promote blood flow. So, to start off, one of the tools that we use is a fascial instrument, right? This is called an instrument, and there's many different kinds of them around now. But an instrument basically helps us to reduce scar tissue or break up what are called fibrous adhesions, myofascial adhesions, sometimes people call them. This instrument helps us to hone in on damaged ligaments, muscles, connective tissue, and it also helps to promote a little blood flow, especially a little blood flow down into the area that's damaged so that we can help to speed up or increase the recovery time, right? Now, this ankle's not too swollen. Sometimes if you sprain badly, you can obviously develop a lot of fluid down in the ankle and the foot. And so we may even use this to push fluid up, back up into the leg, back up into the calf, and then we might do some myofascial work to help push that fluid back up into her hip, which ultimately will leave the body through the digestive tract. So, first part of treatment with an ankle sprain, and you do have some crunchy right through here, right? You feel a little bit of that bump right there. So there's a little bit of scar tissue or damaged connective tissue and ligamentous tissue. And all we're doing is just a very light pressure throughout some of the ligaments in her ankle to help promote some blood flow down into this area. All right, pretty good. Pull your foot up and just hold right there, and we're just gonna do some isometric pulls. Pull your foot up for me. Good. And try to twist out for me. Yeah. relax for me, and come back down. And one of the things that happens when you sprain your ankle is that, again, your ligaments, they stretch out, right? So they, just like a rubber band, if you stretch a rubber band too much, it stays in that like weakened, stretched out, worn out position. So working to rehab the ankle as soon as the ankle sprain happens is very important, because you'll significantly cut your injured time and you'll get back to doing the things that you want to do, whether it's bike riding, running, hiking, just general walking, or exercise of any kind. You'll get back to doing that exercise a little bit quicker when you get it treated appropriately, right? So as we talked about, we have a little damage in the ligaments and the lateral ankle down here, but we can also end up with some strain higher up in the peroneal compartment or the lateral leg compartment. And so second thing that we're going to do is just a general treatment to her peroneal compartment, which is the outside of her leg basically. And you're going to pull back for me, so pull up. And just relax gently down. And again, we're doing more upward strokes as opposed to downward to help get a little bit of the fluid out of the ankle and pushed back up into the bigger muscles, right? So foot up. Can you squeeze your toes for me? And open your toes, squeeze your toes, and open your toes, squeeze and open. And now point your foot, pull your foot. Point your foot, pull your foot. So after we finish pushing some of the fluid out of the ankle back up into the calf, your body, it has all these muscles that act like pumps, right? They act like these like hydraulic pumps. So tonight when you go home, you're gonna work on about 20 toe squeezes and opens, toe squeeze, open, toe squeeze, open. And then we're gonna work on about 20 foot pumps, gently downward and upward, to help get the calf muscle moving, the leg muscles moving, and that's gonna help to push some of the fluid back up into the ankle, right? So, next step, in our office, we use a light cure deep tissue laser, and deep tissue laser helps to promote blood flow and helps to reduce damaged muscle, connective tissue, ligamentous tissue. It basically helps to improve the regenerative capacity of the soft tissue, so things will heal faster with deep tissue laser therapy. This laser, it's just a little red light, and basically what it does, like sunlight helps plants to produce photosynthesis, that energy production cycle. The deep tissue laser therapy will help her body, her little cells, to produce more ATP. ATP is your body's energy molecule. So the laser is going to help the damaged ligaments in the area to basically regrow a little faster. And what we're going to do is just a little laser treatment over top of the area where she sprained and rolled the ankle. Again, it's that ankle inversion sprain. So the lateral ankle ligaments get damaged and stretched out. The peroneal compartment and the tendons right here can get stretched out. Sometimes if you roll your ankle bad enough, you might get an avulsion fracture. So one of the ligaments may kind of pull away from the bone, which would be a little bit more of a significant ankle injury, but still can benefit from the same treatments that we did here. And with the deep tissue laser therapy, if you've ever had this done, there's a lot of different kinds of lasers. This is a class 4 deep tissue laser. So there's like, I think there's like, well, there's class 1, 2, 3 obviously, but there's also cold lasers that come into different classes. I think most of those are class 2 lasers. Class 4 is a little bit more powerful. This is a hot laser, so you do feel a little heat with it. It can get pretty significantly hot, but again, the laser helps to promote mitochondrial production of ATP. So we use laser anywhere. If a patient has an ankle sprain, patellar tendonitis, headaches, shoulder problems, any kind of problem throughout the body, laser will help to promote blood flow, improve circulation, and help the tissue to regenerate quicker. So it's great for anything. And we're going to kind of stop short here, but we would do anywhere from about a 5 to 8 treatment session, or 5 to 8 minutes per treatment. And we would also start to work up in her lateral leg. But just for today's video, we're going to go into the next step, right? So lastly, after laser, sometimes depending on how the ankle is moving, this was your first sprain. If we had a patient that had repetitive 2, 3, 4 ankle sprains, what we would do is spend a little more time teaching her some exercises on this first appointment. Today, all she's going to work on some toe squeezes, some foot pushes back and forth. On her next appointment, we'll get her doing some inversion and eversion, and then we'd move into some weight-bearing exercises also. But I'm going to put a little rock tape. All right, so last step, we're going to use a little rock tape to help hold the ankle in a dorsiflex position, because again, she rolled her ankle down and out. And what happens when you roll your ankle, your muscles, your ligaments, and your tendons, they all get stretched out, right? So a lot of times after an ankle injury, there's going to be some degree of swelling again, but also some degree of instability. And so what we're going to do here is just do a general ankle taping. Up right there. All right, relax. And you can feel how the tape helps kind of hold the ankle in a little bit more of a stable position, right? So a lot of times, again, post-ankle sprain, the ligaments get weak. Her foot's going to be more likely to kind of droop downward due to muscle imbalance in the lateral and the medial side. And a little rock tape post-muscle work, post-laser, post-toe adjustment and foot adjustment will help to keep the ankle in a little bit more of a stable position. Sometimes rock tape or kinesio tape, I like rock tape, is a little better than just a compression bandage because it allows for a little freer range of motion and it's not so restrictive around the joint. So that's a general treatment for an ankle sprain. The most common kind of ankle sprain that we see is an ATFL, anterior talofibular ligament sprain, which can also involve the peroneal compartment, but also cause problems higher up into the lateral knee, the IT band, the iliac crest, the lower back. Ankle sprains generally are no fun because they can twist and throw everything else out of balance. Make sure you get checked by either a chiropractor or a physical therapist post-injury so they can give you some exercises and some stretches to work on to help facilitate and speed up your healing process. I'm Dr. Dan. That is our general treatment of an ankle sprain.